My name is Dr. Jack Tuyahikayo, and I'm a newly qualified physician, and I work with the Makerere Palliative Care Unit. While I was an intern doctor, and I remember caring for patients with chronic illnesses and trying to apply all the clever medicine that I had learned in the medical school, but I didn't think that that was satisfying for the patients and families. And so I got into palliative care because of the practical solutions and the reality that palliative care offers to patients with chronic illnesses. And I think for me, it's more satisfying to deal with the patient's problems more realistically than giving them false hope. So my colleagues were actually not in agreement, kind of to say, because everyone thought they were going to do cardiology, respirology, dermatology, and so on. And also to speak that palliative care was such a new concept that many of them didn't understand at that time. Patients with chronic illnesses are taken through the drills of different investigations and management plans, often with no chance of benefit for these patients. And so that is, I find that to be more academic than realistic. And so the realistic, I mean in a sense that these patients are given a very practical management plan that is probably going to help with their symptom control. And we know that we can engage the family to know the psychosocial distress that they have and the patient has, and also know part of the spiritual concerns that they have. So for me, I think the perspective for patients with chronic illnesses is that one, to kind of see all the issues around their illness and what the illness has caused them, and try and address that. So for me, I think this is typical of the patients that we usually see, and try to sort out and make the tough decisions between, investigating on end and also benefits of treatment thereafter. Really, most of the patients that we see in Mulago have advanced disease, and that palliative care actually showed that they had better outcomes, after receiving palliative care. And so for me, I think that piece of evidence is very important. If we are to extrapolate it in the African region, I think that would be the first piece of evidence, and I think it would provide a springboard for further studies, in our setup. So I think for me, I was excited to have that kind of evidence come through, especially from my study. So really, my first experience to attend the international conference at the EAPC blew me away. I think I got a broader perspective of palliative care. I think that the context that the conference offered to me was much bigger than I thought and I had learned. And I think presenting a piece of work that I had done, and that, it was internationally appreciated, was very inspiring to me. In 5 years' time, I see myself, in a much more research-based career in palliative care. And as a matter of fact, I intend to enroll for a PhD in palliative care. And I hope to have completed that in 5 years' time. And that is going to be a route to do more work in palliative care, especially in sub-Saharan Africa, where we still need a lot of evidence for palliative care in our setup. So I see myself into a lot of research and trying to provide more evidence across the globe. Transferring the knowledge and skills to our colleagues in the undergraduate and postgraduate programs, I think, is amazing. And it's a very well appreciated program. Most of the postgraduates have actually got engaged into palliative care, and we are seeing more consultations coming through by the postgraduates, and we are seeing them being more inclined to providing holistic care for their patients during the routine care. So I think it's a good way to transfer knowledge and skills in a setup like Mulago Hospital. Yeah. That I am heavily indebted to CADIS. They've supported me through my training for the last 3 years. I know that a lot of support, in fact, has come from so many people, but you know, CADIS leading on that. But I just want to highly appreciate everyone who has supported my training. It's been really a great opportunity for me to have extra knowledge and skill, especially to develop palliative care. So for me, I want to say thank you so much, and I will ask the good Lord to bless you so that, you know, He can bless you and enrich you